The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, everybody. Good day to you here in Nashville. It's a beautiful, cool summer, June 22nd summer morning. Really beautiful weather outside. And welcome to TMD Demystified. I'm Tony Urbanek, and I welcome all of the folks, doctors who are interested in learning more about TMD, its causes, its effects, how to treat it, how not to treat it, how to talk about it, how to treat your patients successfully. So today, we're going to talk a little bit technical now. I'm going to switch up kind of the concepts that we've been discussing previously and kind of hone in on one particular simple, not complicated topic. You can make it complicated if you want. I can make it complicated. I can get into the textbooks and spout off all kind of things that are not relevant. Let's just talk about the relevant stuff. So Naomi had a question for me. This is how this came up. It was just the past couple days. We were discussing, I don't know what we were discussing, and Naomi came in and had a question for me. And so I'll just let her go on and ask the question, and then we'll talk about the answer.
Well, so, as an educator, stuff pops in my mind sometimes when I'm doing presentations, doctors will ask questions and it'll prompt me to think further. And so, so there's things simply that I don't know the technicality of, more the medical background of. So I asked Dr. Urbanek how synovial fluid, the lack of or the change in synovial fluid triggered TMJ issues. We hear people talk about their knees hurting. Again, that's a synovial joint. And they'll always say that the weather changes. And when the weather changes, their knee hurts. So I asked him, I simply said, is that relevant to the TMJ? And how does the synovial fluid have anything to do with the joint? How does the change in the synovial fluid affect TMJ issues? So that's not something I'm going to answer on here, Dr. Urbanek. If you don't mind, give us the details about that.
Yeah, happy to. Like I did you. I enjoyed the question from you, Naomi, because it made me think it through again. But the information is rather simple. Again, we can go into the textbooks and talk about biochemistry, and we can talk about all kind of things. But here's what it's all about. As I've stated multiple times, it's all about inflammation within the temporomandibular joint. Inflammation directly causes the symptoms, and inflammation is caused by the three primary causes, which are bruxism, functional malocclusion, and acute trauma. Those are the causes which brings on the inflammation. Now, inflammation within the capsule, within the temporomandibular joint, has multiple effects. But one of the effects that it has is on the synovial fluid itself, the makeup, the content, the biochemistry of the synovial fluid. Without getting into specifics, it's really simple. The synovial fluid is a lubricant, and temporomandibular joint is a synovial joint. It secretes synovial fluid. Without getting into biochemistry, synovial fluid is a lubricant. Now, inflammation in its cellular and matrix components makes the synovial fluid change character to make it sticky. It gets like glue. It gets like sticky, and rather than a lubricant. And this is really the major point that I want to make about that. I mean, it's really simple. It gets sticky. But what does a sticky joint do? Well, historically and within the literature, there is so much literature written about the position of the disc, the 6 o'clock position, the 8 o'clock position, and repositioning the disc surgically, and all kind of things about the disc. Well, it stands to reason that if you can make the joint less sticky, the disc will, to one degree or another, be in a better position. It may not, I mean, once it's loose, once the attachments are loose, it's going to stay loose. But a sticky joint is going to have a major effect on that disc, meniscus. As we talk in our patients, I call it the cushion, which is a good thing to do. If you want to talk to patients about that, call it the cushion. Don't call it the disc or meniscus, because they don't understand that word. Believe me, they don't, but they understand cushion. So call it a cushion. And that cushion is not displaced. That cushion is actually, because it's sticky, every time the condyle moves down through the glenoid fossa, it literally pulls the meniscus forward, because the synovial fluid is sticky rather than lubricant in nature. And then when it's pulled down long enough, it starts to catch under the lip of the glenoid fossa, and most of the time it will come back, usually with a louder noise and some pain. And then after a while, it won't come back, and it sticks out, it stays out here. And when the condyle moves down the embankment, it runs into the meniscus, into the cushion, and you only get halfway open. 22 to 25. I saw one this week, 27 millimeters. She's been that way for 6 weeks. 6 years. 6 years, 27 millimeters. And I guess I got to add, when you allow the inflammation to decrease long enough, frequently, more frequently than not, in fact, much more frequently than not, that disc will unstick. I've seen it so many times, so many times. I don't know the analysis. I can't give you the percentage, but I can tell you it's at least 80%. And it is relevant to how long it's been stuck that way. It is relevant. The longer it's stuck, they can't get open, the less likely they're going to come open naturally when you decrease the inflammation. But I have personally treated, a dozen that have been locked for several years, and they do unlock once you decrease the inflammation. And the synovial fluid becomes more as a lubricant than in a glue. That's the answer about synovial fluid, without getting academic and biochemical about it. It is a good thing to know, and it's a good thing to understand as you think about the temporomandibular joint problem and how to treat it, using the Urbanek device, how to treat it, unloading the temporomandibular joint, what you're actually doing when you do that. All you're doing is decreasing the inflammation. I talked to a patient yesterday. I use this one very, very frequently, but I had a skeptical patient yesterday. Last edition we did, we talked about skepticism. I had a skeptical patient, and I could tell by her couple questions, she was like, really, and I don't mind questions, I love questions, but she was really skeptical. She's, about this little thing that separates the back teeth. And I said, if you had knee pain, if you had long-term knee pain or short-term knee pain, you went to your orthopedic surgeon, and he said, I think we're going to need to do some surgery on this knee. And you go, I don't know. I don't think I want to have any surgery on my knee. And he go, okay. I know. He'd go, okay. And you say, was there anything I can do? He says, yeah. He would order out a set of crutches. And he'd give you that set of crutches. And what do the crutches do? They take the load off the knee. When the load comes off the knee, the inflammation goes away. When the inflammation goes away, the pain goes away. Because as you know from your primary pathology course in dental school, or if there are any medical doctors out there listening, in medical school, because I did it both ways, inflammation, one of the 5 primary characteristics of inflammation is pain. Inflammation causes pain. So when you decrease the inflammation, the pain goes away. If you have a set of crutches for your knee, the pain goes away. If you have a device that separates the back teeth long enough, the inflammation will die down, and what will happen? The pain will go away, along with the other symptoms, the other well-known symptoms. So Naomi's question was a beautiful question. I was happy to answer it for her. Naomi, did you have full understanding now that you can talk to the other doctors about synovial fluid? Can you, when you're questioning about synovial fluid and they say, Naomi, I want to know what the synovial fluid's going on in the temporomandibular joint, you got an answer, right?
I have an answer. I do. And you know that I am full of more questions. So
Good. Excellent. I love questions. I love questions. So I think that covers the point. I don't have any more to say about it. This was a rather short podcast today. But again, we always enjoy your attention. I enjoy your questions. I hope that some of you would like to participate and help patients like we do here in our practice. And as you follow us along, you probably have picked up that we have a company that teaches other doctors how to do this and use our patented FDA device and protocol. It's not a widget. You have to know how to use the widget. You have to use it correctly. You have to take a course, and you have to be licensed to do it because it's patented. So anyone out there who'd like to participate, give us a call, give us a text, knock on our door, come see us. We'll be happy to show you. We enjoy visitors. And I look forward to talking with you again at our next podcast. Y'all enjoy your day and enjoy your week.
And keep the questions coming.
And keep the questions coming.